So what is the diagnosis that majority of Americans have and almost no one knows about and most doctors have never even heard of? It's called diet-induced low-grade metabolic acidosis. It sounds complicated, but simply put, it's mild acidity of your blood in your body due to a prolonged diet of acidic foods, which correlates with our Western diet. I have a degree in biology. I went through medical school and surgical residency, and I have never heard about this illness or been taught anything about it. In fact, we actually spent less than a week on nutrition in medical school. So in Western medical training, it's just not something that's focused on. If you have any of the following symptoms or illnesses, please listen to the rest of this video. The information I have for you is extremely valuable and could have major positive effects on your life. So basically, your blood pH is supposed to be between 7.35 and 7.45. pH is an indicator of how acidic your blood is. So the closer to 7.35 you are, the more acidic your body, and the higher it is, the closer to 7.45, the more alkaline your body is. So if you had your blood pH tested and the result came back 7.35, your doctor would likely review the result and say it's normal because it's within that normal range. But just because it falls within that normal range, it doesn't mean that everything is fine. How can having arthritis pain, heartburn, and constant headaches be fine? It means you have mild acidosis. It only takes mild acidosis to wreak havoc on your body, but it is mild enough for it to go undetected by most healthcare providers. It's a chronic illness in disguise. Studies since the 80s have shown that the acidic environment leads to inflammation and acid-induced diseases, such as osteoporosis, diabetes, high blood pressure, autoimmune problems, cancer, and many more. Your pH level influences every cell in your body. So as your pH rises, the cell voltage increases, which raises energy and performance levels. When your pH decreases and it's acidic, it literally breaks bonds between molecules and causes cells to deteriorate, otherwise known as aging. This is not my opinion or a theory. This is something that can be found in medical physiology textbooks. So think of the baby boomer population whose ages are 55 to 73. They are defined as the people who were born shortly after World War II and make up the nation's largest living adult generation, currently at 71.5 million. Majority of them are not diagnosed with chronic diseases until later on in life. They grew up taking the time to make home-cooked meals. Yes, they did use richer ingredients like buttermilk and lard, but back then these foods were typically locally sourced and did not contain near the amount of additives and preservatives. Due to declining soil conditions, you now have to eat 3 apples to get the same amount of iron as you would have gotten from a single apple in 1940. Millennials, ages 23 to 38, will soon take over as the largest generation at 72 million. Millennials tend to eat more on the go, skipping meals, and eating dishes that are more so out of convenience. Many kids are being raised on chicken nuggets and french fries. So in the next 10 years, we will likely see a trend where people are getting these diseases at younger ages. We are already seeing 5-year-olds getting kidney stones and 20-year-olds being diagnosed with type 2 diabetes. Yes, there are billions of dollars from pharmaceutical companies funding research studies to improve prescription medications, but this isn't solving the root of the problem. If they were tiny little bombs all throughout your body, wouldn't you rather defuse the bombs than let them go off and clean up the aftermath with prescription medications? The younger you are, the easier it is for your body to adapt and adjust its pH. For example, if you eat a fast food dinner, which is very acidic, it's easier for a younger person to buffer that acidity and bring the pH to within a healthy level. As you get older, it becomes harder and harder to fight that acidity and adjust. As soon as you hit the age of 45, that's when we start to see the decline in the ability to adapt, which explains why we get these diseases being diagnosed later on in life. Now, my next video I'll be posting will explain a quick and easy way on how to get your pH back up to where it needs to be. It takes 10 seconds a day, it's easy, it's cheap and painless. I'm so excited to share it with you. After just a couple days, it could potentially cause improvement in your symptoms, decrease your pain, and increase your energy levels.